Hello, I'm Mark Warner. I'm the Executive Dean at Mayo Clinic for the Mayo Clinic College of Medicine. And I'm here today to talk a little bit about an editorial that's in this month's Proceedings. And it's part of the sesquicentennial celebration of a series of articles related to the history of Mayo over the 150-year period that it's been in Rochester, Minnesota. The title of the editorial is "You Trained at Mayo Clinic? Wow." The purpose of the title is a little unique. It's really to identify what it means to be a Mayo Clinic alumnus and why that's special in certain settings. I grew up in a small town in Ohio, and we had a number of physicians who had either trained at Mayo Clinic or who had been to Mayo Clinic for continuing education courses, or perhaps had even come up for a week or two of observation. There was just something unique about somebody that had trained or been to Mayo Clinic from my small town about 600 miles southeast of Rochester, Minnesota. When people talked about their doctors, they often said, "My doctor trained at the Mayo Clinic," or "My doctor went and observed that procedure at Mayo Clinic that he then did on my father, husband, son, or daughter." And that made an impression on me as a kid, hearing people that I respected, adults, talking about the importance of Mayo Clinic. And when someone in my hometown got sick, the local physicians often cared for them. If they were really sick, they would maybe go to a larger city, in my case, Dayton, Ohio, or maybe to the Ohio State University over in Columbus, Ohio. But when they were really ill, they would disappear mystically for, a week, 2 weeks, 3 weeks before they'd return. And as kids, we never knew quite what it meant, except somebody said they went to the Mayo. And it's been my fortune in my career to have spent 35 years now at the Mayo Clinic, and I now have a sense of what caused the awe, the wonderment, and sometimes the deep respect for the physician in my hometown that trained at the Mayo Clinic. Mayo Clinic is very fortunate that its founders, Will and Charlie Mayo, believed in continuing education. They became physicians, returned with their father here to Rochester, and started a practice that eventually became the Mayo Clinic. But they also wanted to continue to learn. Each of them, for example, would go to New York separately, one in the spring and one in the fall, always leaving one of the other brothers back in town, to take continuing medical education courses where they'd learn different surgical techniques, different pathologies, and a variety of other diagnostic approaches. They felt so strongly about it that they would tour anywhere in the United States, Europe, and elsewhere to learn what is new in medicine. By the same token, they thought that they should be able to share what they knew with others, because when they went around, they found people very eager to share information with them. They also found people who weren't very eager to share. It really started a principle or a guideline that is still pervasive at the Mayo Clinic, and that is to be open about sharing what you know, whether it's through education, publication, research, presentation, etc. The concept is what you know at Mayo Clinic should be shared for the greater good. And based on that, they would then invite people to come learn at Mayo Clinic. At any point in time, let's say in the first decade of the last century, so 1900 to 1910, at any point in time, there averaged 30 to 40 physicians from anywhere in the world here observing the Mayo Clinic, and the Mayo brothers at work. And the Mayo brothers made that work. Basically, they would do things and actually even alter their practices and invent things to make it such that people would learn as they were operating, as they were seeing their patients. A good example is that reflective mirrors were added to the booms that held the lights in the operating theaters, so people seated around an amphitheater could look into the mirrors and reflect it down into the wound to observe how a particular surgical procedure was done. Over time, there were so many people coming to Mayo Clinic, they started a surgeons club. Mayo Brothers funded it. They actually bought a home downtown in Rochester, Minnesota that was opened up for all the visitors to use. Basically, they would have nighttime lectures and Mayo physicians would lecture to our visitors, and it became very popular. Over time, though, it was not good enough. The Mayo Brothers decided they should do better, and they decided to open up a graduate medical education program. In probably their most heroic effort, or maybe their most admirable effort, the Mayo Brothers donated well over half of their personal wealth to the University of Minnesota to establish graduate medical education at the Mayo Clinic. In 1915, they enrolled their first two residents, or fellows as they were called, the Mayo Fellows. One was a woman and one was a man in a surgical training program. Over the years, that graduate medical education has grown to now being the largest graduate medical education program in the country, with 154 accredited medical programs, medical and surgical programs, and training well over 1,600 residents and fellows annually. In addition, other programs then opened up. The Mayo School of Health Sciences was started as different allied health fields were recognized through certification. Nurse anesthesia, for example, started at the Mayo Clinic in 1896. Other fields then subsequently opened, and the school blossomed and now trains 80 different programs and different specialties in allied health fields. Graduate school programs then opened up, producing master's degree programs and PhD level graduates, as did the Mayo Medical School, and then ultimately Mayo Clinic Continuing Professional Development, or traditionally what we used to think of as continuing medical education. All these programs go together to help individuals learn what Mayo knows. So, number one, internally we have programs to make sure that all of us that work at Mayo Clinic, and that's 63,000 employees, 34,000 of whom have licenses and provide patient care, that we know what Mayo knows. So we internally train. We also then use our schools and our education to make sure that what we know at Mayo Clinic is available to anyone that would like to have that information external to Mayo. So basically that's the story of Mayo Clinic. It comes from the guiding principles that the Mayo Brothers first established of continuing to learn and open sharing of what Mayo knows. It's the basis of what we do in education at Mayo Clinic, and it's one for which we're very proud. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.